Hi, welcome to Case of the Day, and this is a new week, so we're going to do four more, hopefully. And today, Monday, we're looking at the 52nd case. And just for those who are new, this is typically a case that I've seen or reported or biopsied the same day, or whose biopsy report I've received the same day. Anyway, it's just raining cats and dogs in Mumbai right now. Quite gloomy and depressive, but let's move on. So that's the title. When the spine infection progresses, the value of a repeat CT guided biopsy. So 3rd of April, and I'll put up the link to this. I did a COD. It was the 12th case, and I titled it benign osteoporotic or pathologic fracture, and I'd looked at two different cases that had come in on the same day. And the one on the top was a benign osteoporotic fracture, but it was called infection. The one, the bottom row was called benign osteoporotic, but the patient didn't improve and came for an opinion. I thought it was infection. Clearly, you can see abnormal soft tissue. Um, this was seen on the axial images as well. By the time the patient got ready for a biopsy, 2 weeks had passed and the CT scan shows progression of disease. I biopsied it from the left side, went into the osteolytic lesion and the soft tissue. All the cultures were negative, TB and non TB, and the histopath was reported as highly suggestive of tuberculosis. She was put on AKT and then came for a follow up MR 8 weeks later because her pain wasn't really going away. And so this was about 11 and a half weeks after the first MR. And you can see the four rows. You've got a stir coronal, T2 T1 SAG, and a T2 axial. And there's clear progression of disease between the two MRs, which are about 11 and a half weeks apart, right? So, is this resistant TB? Is this something else? And what do you do next? Just continue treatment, hoping that it will eventually work, or change to second line anti TB treatment, or start IV antibiotics, saying that, okay, it's probably not TB, let's take a chance, or do you rebiopsy? And I know there's a lot of hesitancy to rebiopsy because we have cost issues and other things that come in. But this patient and the spine surgeon were very happy to do a repeat biopsy. And the CT scan obtained at the time of biopsy shows this progression as well. This time I went in from the opposite side into the inferior end plate of the superior vertebra and the adjacent disc, aspirated a lot of bloody material. There was no pus. And eventually on Saturday, we got the reports that the aerobic and mycolytic cultures both had grown staph hemolyticus. Again, resistant to some antibiotics, sensitive to some antibiotics. So this is actually infectious spondylitis non TB due to staph hemolyticus. And it's very important to remember that every infectious spondylitis in TB in India is not TB. The older the patient, the higher the chance of a non TB infectious spondylitis. And there are these signs that tell us it could be one or the other. But one of them is the absence of a distinct collection. If you have a collection, it could still be either. But if there is no collection, then it's more likely to be non TB. In any case, you need to biopsy them. But more importantly, if the infectious spondylitis progresses on treatment based on a prior biopsy, it's a good idea to repeat the biopsy. Sometimes it just takes time for the disease to evolve enough for the organism to be captured. That's the Leadership Summit this Saturday, my WhatsApp channel. Thank you so much for viewing this, and I'll see you tomorrow.